everyone, and welcome again to the Science Area podcast, where we try to establish a link between neuroscience and our daily living towards a better mental health. My name is Dr. Abe, and I'm hosting today's episode of Mental Health Awareness, which is very special because the month of May is an awareness month for mental health, and we're trying to bring this information as much closer to us as possible. So we will be focusing on social determinants of mental health and the importance of support systems, particularly for children and families, because these are somewhat less looked into aspect of the society. So today I'm joined by Somtochukwu, Vivian, a social worker, a researcher, and someone who is very passionate about children, youth, and families' mental health. Somtochukwu works extensively with sustainable development goals that are particularly focused on poverty reduction and some sort of hunger, health education, and reducing inequalities in mental health. So thank you so much, Somtochukwu, Vivian, for joining me on the call today. Thank you for taking our time to be on the call.
Welcome. Thank you for having me. I really appreciate it. Thank you.
Thank you again. So I want to start on the last note that I made. You have been doing some incredible work around social services, trying to bridge a gap between social service and mental health. And so I'll come from this point of your work, particularly your work on children and family. Based on your field works with the vulnerable communities, what are some mental health challenges that you've observed that is more prominent in recent years? And how have this been connected to broader social issues that you as a person advocate for? Go ahead.
Okay, we are seeing actually a lot of mental health challenges, and we come to the understanding that mental health does not work in isolation. So there are other things that, will I say, actually affects a person's mental health. For instance, when we look at in families, we can see things when a family, for instance, has things like good housing, the food security, when the family has, will I say, a good education, where things are actually being stable for them, you find that this family has a greater chance of being able to stand or withstand strong situation. Okay, let me put, for instance, there are instances where you see maybe a child. Let me, because I love working with children. That's actually my specialty. When you're working with a child, and for a child from a family that can actually provide their needs, and a child that is having difficulties in meeting their needs, the way that these two children perform are actually quite different. Because one child has their needs being met, one child has a family that stands by them, a family that supports them, a family that is able to care and listen to them in times of challenges. Another child is craving this opposite attention, this same attention rather, and the child cannot get it. So when it comes to mental health, you find that that these determinants are what actually, will I say, impacts on the general or overall well-being of this child. So when a child is going, or when a child or a family or an individual is going through certain things in their life, you find that they don't just, will I say, it doesn't just happen by itself. There's actually a cause. There's actually a reason why this thing happens. Okay, let me use myself for instance. Okay, as a person, I remember when I was in my final year, I have never had to face any kind of issue, any kind of difficulties or anything. So when it came to my final year, I was writing my projects then. And in my environment where I live, we had an issue. They said something happened to our light. For 3 months, I did not have light. A final year student trying to meet up with defense, and I did not have light to work on my project. So because of that, the way my social functioning was quite different from my mates, because I was under severe stress. I had to meet up with deadlines, and I did not have light or means to make it work. So when I call my friends, let's say they're in the library working, I live very far from school. You get, so I can't always be transporting to going to school to do my project because there's lights there. I am trying to figure out how to save up money to buy fuel so I can use the gen and all that. So before I knew what was happening, I was getting frustrated, I was getting depressed, and I just looked, I was like, what is happening to Nigeria? Why is Nigeria like this? Why are they stressing me? So why am I bringing out this story? There are external challenges that happen. There are things, external determinants that we cannot even predict that actually cause why we behave or react in a certain way. So when we talk about mental health challenges, I actually want to see it from the perspective that this thing actually comes from an external factor. There may be internal factors coming from you, maybe the kind of relationships you find yourself in your environment, but I feel mostly that there are things that trigger the situations we find ourselves in. And when it triggers it, the way we react, like in families now, when things are not going the way they should be, when you are seeing a child that their needs are not being met, when you see a family that is facing a particular kind of issue, you find out that their overall social functioning is going to be completely different from a family that has things going in a completely different way for them. You get? So when we talk about say for us to be able to actually understand mental health properly, we are also going to understand that there are things, external things, there are things surrounding us, situations like our environment, insecurity, political crisis, relationships, something as common as relationship. When I'm talking about relationship, it mustn't be between the opposite sex. It could even be relationship with parents, with siblings, with friends, minor things that we neglect that can actually add stress or can actually be a form of relief to us. So when we're looking at these things, these are the little things we can say, okay, this can actually help us, this can actually improve us. So all these put together are those kind of, like I say, challenges. We can start mentioning things like depression. No, I'm not actually looking at it from that angle. Looking at it from the general things that are around us that can actually put that stress, that can actually put that strain, can actually bring that support to us as individuals.
Thank you so much, Somto. Sorry, I'm always referring to your last name because it's so sweet and to call. So I like the fact that you touched on something around your own experience in school and how environment or some environmental cues could trigger some of this experience and even the behavioral response that may come forth as a result of what you're currently experiencing in your mental status. Now, I want to also take you on based on the example you gave about school. And I will, if you have a different opinion, you can always reiterate that when you're answering the question. I believe that the mental health status in schools, the way it is being addressed, especially when it comes to youth programs and even in children in secondary schools or in primary schools and the likes, have gained some significant shift in the recent years. I don't know if that is in line with what you have based on your field work. Based on your own research work and even your field work, what are some of the interventions that you've seen that has been effective in supporting the mental health of youth? Because these are somewhat very important part of every society. Go ahead, Vivian.
Right now, the beautiful thing I'm seeing is that people actually speak up about, or rather, would I say people are being encouraged to speak up about their mental health issues or challenges. Unlike before, where the issue of stigma is quite the most prevalent thing we can see. At least let me know in the part of, would I say, primary education in Nigeria, at least within my area, unfortunately for now, mental health discussions are not really something that are being held there. But when we talk about youth programs, yes, over there you begin to encourage youth are being taught to speak up. If you're facing this issue, you're facing this challenge, or maybe you feel you're not mentally stable or capable enough, it's not something you should be ashamed of. It's something you should be proud of. It's something you should speak up, because if you don't speak up, you cannot be able to seek help. So when it comes to issues like youth programs and the rest, yes, they are being encouraged. These are like when it comes to interventions now, whenever we go out for outreaches and stuff, we tell them, okay, if you have this issue, talk. If you have this thing, seek community, seek support system, and like seek people. But when we come to primary education, unfortunately, these people, like, they don't even know what mental health issues are. You're working with this child and you're telling that this child has this particular challenge. But due to the way the environment is, due to the way the community is, it's not working over here. That's just the truth. It's really not functional over here. Like when I was reading something recently, I saw that schools as early as let's say kindergartens and the rest, they have this mental health support system available for them over there in Western countries. But over here in Nigeria, it is very hard. Unfortunately, through my 4 years in the university, if not that I studied social work, I would never have had any issue with mental health, like any kind of course that taught me about mental health. If not for the kind of my line of work, my profession, it is not obtainable here. You can finish a university and you cannot even have that kind of encounter where you're being taught about mental health. But right now, organizations, outreaches, all these initiatives are putting in their best to make sure that, okay, if you're having this issue, come out. And when the best for the few people, or will I say for the very, very few handful that actually work on this thing, the best method that has been working is the early intervention, where these children, we teach them from at that early stage, what are you facing? What are the problems? That's that stage of early intervention. You talk to them. You want to figure out what is going on. We develop support system. Maybe there's this auntie that they trust, or there's this social worker that comes to school that they trust, they reach out to that person. And another way that we can also handle this issue is through positive education. We always teach them to be resilient, to be strong, to overcome, positive mindsets. These are the ways that we have been handling it for now. But it would also be amazing if, like, when it comes to mental, we need more partners, parents, siblings, aunties, religious leaders. We need everyone to put hands together to actually make people aware, or make people understand that when it comes to the issue of mental health, be there for this child, be there for your friend, be there for your neighbor, be there for anybody around you. That is the way I feel that that would be for the stage we are in Nigeria. I don't know about maybe other developed nations, for the stage we're in Nigeria right now. Because when it comes about, okay, where are these, where can I see support system, where can I see support group? Unfortunately, they are not known. There was a research my friend and I carried. It is not known. When you're talking about mental health, people are more or less withdrawn because they don't want you to see them as though they have mental illness, or they need deliverance, or they need prayers. So we are still trying our best. That's the beautiful thing. Please come out from that shackles of that kind of thought. Yes, it is okay not to be okay. It is actually okay. So far you don't remain there, you don't remain in that state. It is actually okay not to be okay. Come out, speak to us, talk. Let us help you. If we cannot help you, let us refer you to people who can help you. A friend of mine, her best companion right now is AI. That's what she was telling me the other day. That's AI. She can just talk to AI, share according to AI, and AI is so kind, so friendly. Because people actually need someone they want to talk to, someone that will make them feel okay, someone that will make them feel that they can overcome a difficult stage in their life. So, but early intervention, by building support systems, by building by promoting positive educations, so far this little stage, though it is not popular yet or well known, or something that you can just walk and every child knows, but these little things are the things we have been doing so far that are seen to be effective for
Thank
now.
you so much, Vivian. That was spot on. You talked about awareness, which is one of the things that we're trying to do now. May is Mental Health Awareness Month. We're trying to make people feel, just like you said, it is okay not to be okay, just in as much you don't remain in that position. You try as much as you can to come out of it and speak to people that may be able to offer help, and also be a support system to other people that may be going through this. And I also like the point that you mentioned around early intervention. Before it goes to or degenerate into something that would need a more high hand to handle, it's good that some of this early intervention kicks in early as possible. And I'm happy that you said that this advocacy and this awareness is also coming up in our own society, where we have people getting more free. And thanks to telemedicine, as you mentioned, I think a lot of people are also reverting to it now, where they're able to speak to someone online, or even psychologists or social workers online, without having to have a physical contact with them. Thank you so much, Vivian, for that response. But I'll continue by asking that, based on your own advocacy and some of the works that you've been doing together with your friends on this SDGs, the Sustainable Development Goals, how does this connect with the global goals? Looking at our own peculiarity, and when it comes to mental health, and particularly, how has this worked? Has it fared enough in reducing inequalities, connecting it to other parts of the world?
Okay, so far we are looking at particularly when the particular SDG goal that I would see that addresses that issue of that addresses, will I say, mental health equity, has to be SDG 10, that's reducing inequalities. If you look around right here now in Nigeria, like I said earlier, mental it's not so easily accessible to, maybe you're facing a challenge, you want to speak to a counselor, or you want to speak to a psychiatrist, or you want to speak to a psychologist, or you want to speak to a social worker. So, but this, if we can actually have more of these available, okay, we don't need to walk to an office to actually get this. If it can be made that through your phones, or through maybe a chat with a social worker or somebody, we can actually get this done. It would actually go a long way. Get so if we can have these global goals, now talking about bringing out so many diverse goals and all, if we can have more access to mental health services, mental health professionals available that actually have the best interests of these people at heart, it will make a whole lot of difference in schools, in workplaces, even in religious organizations. If all these things are obtainable there, maybe we don't. In fact, when I think of this thing, I don't know how the possibility of it being up to the standard of, well, I say, developed nations, but we have to do something at least. Because if we keep waiting for it to all of a sudden wake up and we are like in the US or in the UK where things are functional, where things are working, it will not happen overnight. If professionals can come out, give it their best, and also professionals cannot come out if the government is not supporting, because there's a limit to what we can do. We cannot like exceed or beyond a particular limit. No, there's actually a limit to what we can do. But if we can actually see this external support, opportunities being created, and work has been placed in the right place that they should be in, you find out that yes, despite the unequal access we are facing, at least there will be a significant change made till the time that everything becomes eventually perfect. But for now, the little steps that we can make will I say, making this difference, let us all make it as professionals in our diverse fields. So in terms of when we come to advocacy, I even say that even school teachers should be aware, like primary school teachers, secondary school teachers, because we know that it is almost impossible right now, especially in government schools, when you go out and you see that this school has a social worker there. After having teachers, they will have a social worker or they will have a psychologist. It is very, right currently, I don't know about, but within my location, it's actually very difficult to find a school that even has an infirmary, like a clinic for a child that may be doing break, they hurt themselves. It is difficult to even see a school that has a clinic. Talk more of bringing out all these other professionals there. So when we know that due to the state of things, all these things are not available, it would be great if teachers can be trained in this field, making them to be aware, okay, look at child, if your child is behaving, if a student in your class is behaving in this particular way, if you cannot help, call this line, do this thing, do so. So it should actually make a whole lot of difference for that person. Thank you.
Thank you so much, Vivian. I like the fact that you said, if we can have to, just from your last point, if we cannot hire someone, a professional, train the teachers, train the people who are in the community. So when there is a first-hand issue, they know what to do, more like a first aid mental health. I think there's something like that, mental health first aid, that people can render support at any point in time. And I would like to continue this way, that you as a social worker, in line with other people who are frontlining the support of families through their challenges. There are so many experts that now recognize that understanding neurodiversity is very, very crucial in comprehensive mental health support. When it comes to the perspective of human divergence, how has it shaped your work? Does it have any impact on your work? What do you think when it comes to educational settings? You mentioned something from your last point around teachers knowing what to do when you have a particular behavioral response from their own students, or maybe even as a community member, what to do when you have a first-hand behavioral response. So what do you think about human divergence or neurodivergence in this kind of settings, especially the educational settings where we talk about early intervention?
In social work, there's something we call principle of individualism, where we see everyone as unique, everyone as different, that that this particular person, you're special the way you are. So when we are talking about neurodivergence, we also understand that the way this person thinks, the way this person performs, the way the brain functions of this person is unique to this particular individual. So for that same way, we should understand that every child is unique. Every parent should already know that their child is the way they are. You should not, expect that child A behaves the way child B should behave, or child B should behave the way child C should behave. When I was posted to a school as a school social worker at a particular time towards my final year, in my final year rather, and I noticed something when I got to the class, because the first time would be like observation, trying to understand the children, trying to know what's going on. And I noticed there right there that there was a particular child that was just always like withdrawn. Even to speak up is a problem. Okay, to even write is its own. You get? So I had to speak to the teacher. The teacher was like, this child, like, she said she gave her own opinion of what she feels is wrong with the child. And I just realized that this child is not dumb, or this child is not dull. The only issue is that this child needs a different format of learning. That unfortunately, you know this thing that they say, a bird cannot swim while a fish cannot fly. We hear something like that. The same way a snake cannot walk, the crawl or whatever. So this child is actually unique the way they are. But when I say the teaching system, everybody, you can fly or you can swim or you can crawl or you cannot even do anything, you are under that same mode of teaching. So when one does not really perform in a particular way, be like, oh, this person is dumb, or this person is not dumb, or something like that. Well, when I started paying a little bit more attention to this particular child, and I realized that, oh, this child is actually smart. It's just that the way teachings are being done, this child is just not fast enough yet to catch up. This child needs a little bit more care, a little bit more attention to catch up. But unfortunately, I don't know whether they have that kind of patience to, will I say, mold this child to meet up to the others. Because, come on, they're handling over 80 children in a classroom, and paying a particular attention to just one child is not realistic. You get? So when we look at all these kind of things, you have to understand that people are different. So when we want to address this issue, we should address it in the light of their uniqueness, in the light of the situations that they face at home, in the light of the circumstances that surrounds them. If I have malaria and you have malaria, sometimes the kind of treatments that you get may not be the one I get, because some hospitals would like to know your past medical history to know how to treat you. They don't, that is for good hospitals. They don't give us general treatment, because there's something that they may give me to treat me that will react to me. So that's why we have to take cognizance of the overall well-being of this person to actually know the best approach to take when handling this particular situation.
So that was spot on, looking at the uniqueness, identifying the uniqueness in individual. As we wrap up this series, I just want us to, I want to get a take-home message from you. What would you like to share with everyone about building mentally healthy communities for diverse children and families, even as we are creating awareness around the mental health month, calling everyone to be in this consciousness? What do you think? Or what will you be saying to everyone that will be listening to this podcast, on the short or on the long? Briefly, please. Thank you.
I would actually want everyone to understand that whether you face any challenges or you face any difficulties or whatever it is that you may be going through, it is actually okay to feel that way you are feeling. It is actually okay to feel that you are not okay. It is part of life. You are human. We make mistakes. We go through processes. But where it would not be fine is if you remain in that you're feeling, you're being submerged in that you're feeling, maybe that feeling of doubt or that feeling of shame or that feeling of depression. It is actually okay to feel that. But please come out and seek help. Look for communities. It could be your friends, it could be your family, it could be someone on your phone, it could be someone you listen to, a model, or maybe you're a role model, somebody that you adore, and you actually take let's say high, you see that person in high esteem, or whatever it is that you seek comfort in. Please seek help from someone around you. It would actually go a long way in helping you overcome whatever situation it is that you're going through. Thank you.
Wow, thank you so much, Somtochukwu. Vivian, I love to listen to Somto. Thank you so much for sharing your valuable insights on the call today, as a social worker and as a mental health advocate, specifically for children and family. And your perspective has reminded us that mental health support requires both individual care and also a systemic care, calling out agencies and government bodies to support this body of people who are trying to frontline the advocacy for mental health, even at the early stage, right from the schools, the primary schools, the secondary schools, and even at youth program levels. And to everyone that will be listening to this podcast, remember that mental health awareness is all about building an environment that everyone can thrive in. It's very important that you have your space, I have my space, and we are all able to thrive towards our best person and our best brain health. And that starts with children and families in your own community. So everything you can do to support them, please go ahead to do. And remember that Science Drive Podcast is always here to bring fascinating insights around and connect some neuroscience to a mental well-being. Thank you so much for joining this call, and thank you to everyone that will be liking this video. Please share to everyone. This is part of mental. You're doing your own content by sharing to your community. Let people know that they can come out of their hideout and be free to discuss what their inadequacies are. Thank you again. Please share the video and like it, and also refer people to their places where they could get help. Until next time, this is Nosarime Abe saying thank you and bye for now.